Hello and welcome everyone. Today we are learning about retic stain. Reticulocyte. During the maturation process of erythrocyte in bone marrow, the nucleated RBC ejects its pycnotic nucleus and it is converted into reticulocyte. Reticulocytes are immature red blood cells produced in the bone marrow and released into peripheral blood. Reticulocyte turns mature RBC within 1 to 2 days. In comparison to mature RBC, reticulocytes have a greater volume, higher hemoglobin content and low hemoglobin concentration. There are two methods to measuring reticulocyte. First is flow cytometry. It is faster and more precise way of measuring reticulocytes. Second is manual standard technique is supravital dye stain, that is new methylene blue stain. This stain is designed to highlight the RNA as a blue color. The stain allows cells to be recognized by the blue intracytoplasmic precipitate ranging from appearance of granules to a network of reticular material. The principle is the RNA within ribosomes reacts with basic dyes such as azure B, brilliant crescile blue or new methylene blue to form blue precipitate. This manual technique is useful in under-resourced laboratory. Let's learn the procedure. First take a test tube, add 2 drops of dye and add 2 to 3 drops of well mixed whole EDTA blood into this tube and mix well. After mixing, put a stopper on the test tube and put it into the incubator for 15 minutes. Incubate at 37 degrees centigrade. After incubation, mix well and now prepare the smear. Take a glass slide, add 1 drop of mixture on the slide and spread it with another slide and make a smear. After preparing the smear, let it dry and look at under 100x or oil immersion microscope. This is the microscopic pictures of reticulocytes. Let's discuss the Elmer stages of reticulocyte. Stage 1, it suggests dense clot of reticulum, which is indicated by figure A and B. Stage 2 is extended network of loose reticulum indicated by image C and D. Stage 3 is scattered granules with diffusely arranged reticulum indicated by image E and F, and fourth stage is scattered granules. How to count the reticulocyte? Reticulocyte count is equal to reticulocytes number in 1000 RBC into 100 upon 1000 RBC. The normal reference range is 0.5% to 2.5% in adults and 2 to 6% in infants. We need to correct reticulocytes in cases of anemia. If the patient's HCT is less than 45, then the formula is obtained retic percentage into patient's HCT upon 45, which is ideal HCT. Now let's learn some causes of reduced reticulocytes and increased reticulocytes. Reduced reticulocytes are seen in hypochromic anemia such as iron deficiency anemia, sideroblastic anemia, anemia of chronic disease, aplastic anemia, aplastic crisis in hemolytic anemia, nutritional deficiency and myelodysplastic syndrome. Increased reticulocytes are seen in hemolytic anemia and blood loss. Other values related to reticulocytes are immature reticulocyte fraction. This is the value of immature reticulocyte measured as a ratio of immature reticulocytes to total amount of reticulocyte. And second is reticulocyte hemoglobin content, CHR. This is a useful indirect measure of iron deficiency anemia. It measures the amount of iron available in the bone marrow that can be used by reticulocyte for the production of hemoglobin. Multiple studies have shown that CHR of less than 28 picogram is a good predictor for iron deficiency anemia. So this is in short about reticulocyte stain, and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.